Getting a gestational diabetes diagnosis often brings the entire household to a standstill. Suddenly, every meal feels like a test, and the kitchen you know so well feels like a minefield. Dr. Prashant advises prioritizing the timing and composition of your meals over simply reducing calories. Success in GDM management is found in precision, not restriction. We need to prevent sharp rises in blood sugar after a meal. When your blood sugar spikes, that excess glucose crosses the placenta. This forces your baby's pancreas to produce extra insulin, which causes the baby to store excessive fat. To prevent those spikes, we are going to rebuild how you eat. By mastering a strict 6-meal timeline and re-engineering your standard 10-inch dinner plate, you can keep your post-meal blood sugar safely under the 120 milligram per deciliter limit, all while fully nourishing your growing baby. The traditional pattern of 3 massive meals a day creates a problem for GDM. Long fasting gaps, followed by a heavy feast, create crashing waves in your blood sugar rather than a steady, manageable flow. This diagram shows your new metabolic clock. We are dividing your daily food intake into 3 main meals and 3 specific snacks. Notice how they are spaced strictly 2.5 to 3 hours apart. Your 8 a.m. breakfast must be heavy in protein. Starting your day with pure carbohydrates, like plain poha or upma, will cause your sugar to spike immediately. Instead, choose a high-protein option like a moong dal chilla. Think of the 11 a.m. and 4:30 p.m. snack slots as nutritional bridges. A small bowl of curd, a few soaked walnuts, or a handful of roasted makana will keep your energy stable between main meals. This 10:30 p.m. bedtime snack is critical. Having a glass of warm milk or a small bowl of oats prevents your blood sugar from dropping too low overnight. Without it, your liver reacts by dumping glucose into your system, causing a massive spike by morning. Sticking closely to this 3-hour rhythm is your primary defense against waking up with a fasting blood sugar level above the 95 milligram per deciliter threshold. Now we must fix the structure of the meals themselves. The traditional Indian thali is usually dominated by a large mound of polished white rice or several large chapatis, leaving little room for anything else. This graphic demonstrates the plate method. We take a standard 10-inch dinner plate and divide it precisely, 1 entire half and 2 smaller quarters. This is your physical tool for enforcing portion control. Fill that large 50% section with non-starchy vegetables like ash gourd, cabbage, or leafy greens like pollock. The dense fiber in these vegetables acts as a physical barrier in your gut, slowing down how fast glucose enters your bloodstream. Next, assign 1 25% quarter to thick proteins, a hearty bowl of dal, sprouted moong, or paneer. Protein is essential because it stimulates a hormone called GLP-1, which helps your body's natural insulin work more effectively. The final 25% quarter is reserved strictly for your complex carbohydrate. This is a hard limit, exactly 1 medium multigrain chapati or 1 small katori of unpolished rice. If you ignore this limit and double your rice portion, your blood sugar will likely exceed 140 milligrams per deciliter. This high sugar triggers the baby's kidneys to overproduce urine, which creates excessive amniotic fluid, a condition called polyhydramniosis that often leads to preterm labor. This 50-25-25 ratio is the physical tool you need to control these fluid levels and protect your delivery date. Let's talk about the ingredients inside those portions. The glycemic index ranks how fast a food digests. Highly polished white rice, like Sona Masuri, or Maida-based breads, have a high glycemic index. They digest rapidly and flood your system with sugar. To fix this, you need to adjust your flour. Move away from pure wheat atta. Instead, mix your whole wheat flour with besan or soy flour in a 3-to-1 ratio. This creates a fiber-rich misi roti that keeps your post-meal sugars in check. For lunch, replace that high glycemic white rice entirely. Swap it out for broken wheat, like dalia, or finely grated cauliflower rice. This simple substitution drastically lowers the glycemic load of your entire meal. But be careful with low GI alternatives like millets. Raji is healthier than white rice, but it is highly calorie-dense. A low GI label is not a free pass. Your portion must still be strictly controlled, to roughly the size of a tennis ball. By making these precise ingredient swaps, your family can continue enjoying culturally familiar meals that release their energy in a sustained, safe manner. Now we must address common ingredients that can quietly disrupt your metabolic control. Many households believe adding jaggery or honey is a healthy alternative to white sugar. But for a GDM patient, your body processes them identically, triggering the exact same spike. The same rule applies to packaged sugar-free or digested biscuits. These are often loaded with refined flours and fats that make blood sugar targets impossible to hit. This chart compares a glass of orange juice to a can of soda. Notice the blood sugar lines. They are identical. Juicing removes the fruit's fiber, the component that prevents a rapid sugar spike. For GDM management, fruit juice is effectively liquid sugar. The safe way to consume natural fructose is to restrict yourself to a single 100-gram portion of whole, chewed fruit, like an apple or pear, just once per day. Combining the strict 6-meal timeline with the 50-25-25 plate establishes a steady stream of nutrition, shielding your baby from the effects of excess insulin. To verify this is working, you must test your sugars consistently for 1 week. Your targets are strict. Your fasting sugar must stay under 95, and your 2-hour post-meal sugar must stay under 120. However, you must contact your doctor immediately if you experience sudden symptoms of low sugar, like trembling or cold sweats, if you begin losing weight, or if you notice a sudden decrease in your baby's movements. Medical nutrition therapy is your most powerful first line of defense, but recognizing when it has reached its limit is just as important. If your sugars remain high despite these changes, prescribed medication is the necessary next step to protect both you and your child.